Good afternoon, everyone. Good afternoon, Chairman and Co-Chairman. I'm Dr. Kriangkamol Benjawongsathien from Pattaya Hospital, Pisanodok. Today, I will talk about the PCL reconstruction with the suture augmentation. Why do we talk about in this topic? Because PCL reconstruction have a high complication and high failure rate than ACL, and the most common complication is the persistent posterior laxity, and the serious complication is the neurovascular injury. The persistent posterior laxity is most common. You may detect the cause. If you meet the associated ligament injury, especially the PLC, which the failure rate is so high, is 40%. And the second is the tunnel malposition especially in the femur, is too proximal and too posterior, have a maybe failure. The third is the decreased tibial slope is a maybe cause is a linear fault to the increased width of the PCL graft is a maybe failure. And the last choice is you aggressive and early rehabilitation is a maybe failure. If you want to put the PCL reconstruction good outcome, the first you have a big graft or large graft and a good fixation technique and implant, and the suture augmentation internal base is good or not. What is the internal brace? Internal brace have a ligament augmentation device. It's made from ultra-high molecular weight polyethylene or polyester suture tape. It's provides strength during the graft healing or ligamentization to early return to sport and prevent re-injury. Advantage of the internal brace is provide strength. It have a decreased the graft elongation under cyclic load, and have increased the ultimate failure load and increased stiffness, and protect the graft healing when the graft healing or ligamentization. And the third is the good compatibility without the severe reaction. The internal brace action as a seat belt in the car. Many papers in the myomechanics study in the ACL reconstruction with the internal brace. The group to add the suture augmentation increase stiffness, increase the ultimate failure load, and decrease the total graft elongation. Many papers in 2020 to 22. And internal brace is safe or not? This is the animal study to the suture tape. It divided at the first is the intact suture tape, and the second group is the transect suture tape, and fixed in the joint and rearthroscope as said in the 4 and 6 months. The result is if reassess the arthroscope, have a no and mild synovitis, and to check to the histology, the both group intact or transect fiber tape is no apparent cartilage damage in 6 months. And many papers to the clinical study in the ACL reconstruction with the internal brace and follow up 1 and 3 years. The result is no severe reaction and no synovitis, no erosion and no cyst formation. The conclusion about ACL reconstruction with the internal brace, the group with the add suture tape is better than without group, increase stiffness and increase ultimate failure load and decrease the total elongation. But in the clinical study with the ACL with the internal brace and no significant difference than without group, it may be safe, it's no synovitis, no cartilage erosion and damage and no cyst formation. But the PCL reconstruction is better or not? Let's see the paper. The first is an animal study, check the biomechanics study, have divided the 4 groups. The first and second group use the outside femur and tibia and with or without the suture tape. And the third and the fourth is outside femur and tibial screw and with or without suture tape. And testing the biomechanics study to testing the dynamic total elongation, ultimate failure load and the stiffness. The result, group 2 add the suture tape and outside and tibial screw is decrease graft elongation, increase stiffness, and increase the ultimate failure load than without group. But the group to use the outside femur and tibia and suture tape is high as stiffness and high as ultimate failure load. The next study in the cadaveric study is the way in the 6th group, and the first PCL intact, and the second PCL deficit, and the third and the fourth and the outside femur, tibia, and with or without suture tape, and the third and sixth is the outside femur and tibial screw with or without suture tape. To check the posterior tibial translation, the result is the fixation group is both all inside femur and tibia and add to suture tape have a decreased posterior tibial translation nearly the PCL intact. And the group to add the suture tape have a decreased posterior tibial translation than without suture tape group. And the group to add the suture tape is a decreased posterior tibial translation and displacement than without group many flexion angle in the 30, 60, 90, and 120. And the clinical study in this paper is a PCL reconstruction with the internal base. Use the Foster hamstring graft is have follow-up 2 years and use the outside femur and tibial screw and augmentation with the internal base with the suture anchor. Follow-up 2 years, the result is post-operative is have the group to use the internal base may have increased the IKDC score, thickness score, Lindholm score, and improve the KT1000 stability. And 90% return to normal activity and 70% nearly to competitive sport. I think it's a good result in this paper. And the next paper is a comparison PCL reconstruction with and without suture tape. The study to use the all inside femur I think is a good fixation and use all with or without suture tape and have an autograft, Polonaise long graft. The side graft is big, it's a 10 or 12 and range okay. The result of the study, the group to use the PCL reconstruction with the suture tape may have decreased the side-to-side difference in kneeling state film, but the other many things is IKDC, Lindholm, thickness, and VAS and posterior dorsal is no significant difference. I think the conclusion about the PCL reconstruction with the internal base. The first is the biomechanics study. The group to add the suture augmentation better than without group. The group to use the suture augmentation have a decreased elongation the graft, the increased stiffness, increased ultimate failure load. The group to use all inside femur, tibia, and use the suture tape, high edge stiffness and high edge ultimate failure load, closely native PCL. But the clinical study, the PCL reconstruction with the internal base, I think is no significant difference. But I show some case for you. This is the female 20 years old. Patient have a thin and short patient and have an injury around 1 year. The diagnosis is MCL and PCL, left knee. This case, I performed the PCL reconstruction with the Polonaise long graft. Patient have a short and thin patient. We have a small graft. I think it's suitable for the use the internal bend. The graft is 7.5. When I check the arthroscope, the ACL is laxity and the PCL, the partial torn about is 70%. And meniscus AM and lateral medial and lateral meniscus is okay. I perform the 4 portal is the AM, AL, PM, and PL portal. And PL portal, I aware the common peroneal nerve and transeptal technique. And the femur, I use the outside in technique and use the endobaton and use the suture tape. And the tibia, I use the tibial screw and use the suture to put the augmentation, the suture and graft and internal base. And after I fixation, I test the severity of the ACL and PCL is okay and realize to the normal starting knee and post-operative film is okay. And the take-home message about the internal brace, I think internal brace is a provide strength, it increase ultimate failure load and increase stiffness. The second is protect the graft failure during graft healing and graft ligamentization. It's safe, it's in the clinical study. The group to add the suture tape better than without group in the biomechanics study, but the clinical study it have a controversy. The group to use the all inside femur and tibia and suture tape is a high edge stiffness and high edge ultimate failure load, closely native PCL. Advantage in internal base, I think it's for professional athlete. Patient have a small graft, patient have an overweight patient to protect the graft. Thank you for your attention.